feel the benefits of being a complete health dentist for my patients is that patients see their dentist more frequently than they see their physician. And we have learned that the mouth is the window to the rest of the body. So when we see our dental patients, we have the ability to review health histories, screen for blood pressure, do oral cancer exams, do sleep apnea screenings, as well as look at the patient's health history and see if they have a genetic predisposition based on their family's health history. Do they have diabetes? Do they have heart disease in their family? One of the benefits of being in the same facility of the cardiologist, Dr. Eric Goulder, is if we see a patient that has some high risks and maybe a candidate for heart disease, he can do a simple carotid artery scan, look in the inside of the artery wall to see if you have any plaque or thickness in your artery. It's a very simple test, and it's a great segue for my dental patients to have a little more information about their carotid artery health, and could be the segue into preventing a heart attack or stroke. When I had my first carotid artery scan, when I went to my first meeting of the American Academy of Oral Systemic Health, I was 55 years old, and my carotid artery scan came out saying that I had the vascular age of an 83-year-old. This is the start of my story, and why I became so interested in being a complete health dentist is I had information that led me down a path of taking charge of my own health and start looking at all my other markers so that I could prevent heart attack and stroke. I have 3 generations in my family of heart disease. I exercise, I eat well. I thought I was going to pass this test with flying colors, and my test stopped me in my tracks, and I realized how powerful education really can be. I believe that I prevented myself from having a heart attack or stroke 10 or 15 years down the road.
The carotid artery scan is a simple ultrasound test. It's painless. It only takes us about maybe 10 or 15 minutes to do a full scan. It only takes about a half hour. And it gives us valuable information. We can actually see the lining of the carotid arteries to a detail of perhaps 0.2 of a millimeter. We're looking for thickening the lining, which would be an indication of more atherosclerosis or more cholesterol buildup under the artery, or actual plaques, which is a blockage developing in the artery. Seeing that blockage is very powerful for patients. I can tell a patient that they've got some blockage, but it really doesn't mean anything unless they can really see that picture and see that there is something in their carotid artery that could cause them a stroke or be a marker for significant coronary disease leading to a heart attack. So we use this not only for diagnosis, we use it to empower the patients to get them on board with the treatment plan, and we use it to follow the patients serially so that if we see that they have disease and we're treating it aggressively, is it not progressing? Is it perhaps regressing and going away? So that's the threefold value of the carotid scan for us.